In this video, we'll see the GST exemption on services by way of a healthcare service. This is covered by notification number 12/2017, entry number 74. In that entry, certain definitions are given. Let's see what are the things that are defined in this entry. Is the authorized medical practitioner. Means what? Means a person who is registered with a recognized medical council. And what are the systems that are recognized as recognized medical systems in India is Ayurveda, allopathy, homeopathy, Unani, Siddha. What is basically it means a person who is undergoing in a formal training, passing an exam, and after that he becomes a member of the medical council, which is called as registered with any authorized recognized medical council, is basically a doctor. And the clinical establishment is also defined. What are the things that are included in clinical establishment is hospital, nursing home, clinic, diagnostic center. Diagnostic center should not be necessarily be within a hospital. It may be away from the hospital, doing only the diagnosis, not admitting any patient. They may come home to take the sample of the blood. All that is covered by this exemption notification. Okay, then any establishment which is offering a treatment to the ill person, that is also covered. What it basically means, suppose in a factory there is a doctor, all first aid tools are available. So if there is any injury to any worker, immediately the medical facility is available. That is covered here. Let's go to the next definition. Is a healthcare service is also defined in entry number 74 of notification 12/2017. What it specifically mentioned, it is healthcare service means a service by way of a diagnosis, treatment, care for illness, injury, abnormality, pregnancy. Pregnancy is also included in the healthcare service. Basically, pregnancy is not an illness. However, it is still specifically included in the healthcare service. Therefore, the exemption is available even for the pregnancy. Then the second part is it include all types of ambulance service. There's a separate slide on this, but it include all types of ambulance service, whether provided by the hospital, by the private party, by the government, anything. What it exclude, it's very important. What it exclude is a hair treatment, hair transplant, then cosmetic, plastic surgery. This is not included in the definition of healthcare service. What it implies that if there is a plastic surgery, then that is chargeable to tax to the GST. However, suppose let's take an example. Suppose there is a worker who is working in a factory due to some accident, acid reaction, his face is damaged. To correct that, there is a plastic surgery. That plastic surgery is to cure the illness. It is not cosmetic. Therefore, it is covered by the definition of healthcare service, and that is exempt under entry number 74. Let's go to the next. Hospital room rent. See, previously, means before 22, financial year 22, all types of healthcare service were exempt. Entire bill, doctor, nursing, room rent, operation theaters, charges, etc. In the year 22, that is 18th July 22, government issued a notification for 2023 where it provides that if the room rent, which is not a ICU room, is more than 5,000 rupees per day per patient, then it is chargeable to tax at the rate of 5%. It is not exempt. It is partially withdrawn the exemption. So if a room which is not an ICU room, where the charges are more than 5,000 rupees per day is not exempt, is chargeable to tax at the rate of 5%. However, where the room is a normal room, where the charges are less than 5,000 rupees per day or up to 5,000 rupees, it is still exempt. In case of ICO, the exemption continued irrespective of the charges. Important amendment. Okay. Yes. Let's go to the next. Next is immediately take an example that there is a consulting doctor who is not an employee of the hospital. He comes, he visits to the hospital, give treatment to the patient. There is no direct contract between that doctor and the patient. GST officer may take a stand. Then in that case, a consulting doctor has given a service to the hospital and hospital in turn given the service to the patient. So the doctor giving service to the hospital is not exempt. However, CBEC has issued a circular number 32 in 2018 where it specifies that even a consulting doctor who is not an employee of the hospital giving services of consultancy, checking the patient, healthcare is included in the healthcare services, that is still exempt. Continue with this example. Let's move to another, that suppose that consulting doctor given a treatment to that patient, services, healthcare services, and hospital charges rupees 10,000 from that patient. Hospital paid to that consulting doctor 7,500 and returned 2,500. So whether that amount returned by the hospital is chargeable to tax or is exempt. CBEC in the same circular number 32 2018 clarifies that the 2,500 is for preliminary healthcare service like taking the temperature of the patient, measuring his height, weight, blood pressure, etc. So that 2,500 retention money by the hospital is also exempt. Let's go to the another point. It is the same that what is the logic to be remembered, that any medical treatment given to cure the illness is exempt. What it means that any medical treatment, anything is done for care is not exempt under entry number 74. Let's take a simple example that there are dietitians who provide the service that is not covered by entry number 74 because that is for care, not for cure. There is no illness, there is no patient. Let's go to the next point. GST exemption for ambulance service. All types of ambulance service are exempt, whether it is provided by the hospital, by the private operator, or by the government agency, or by the government. Exempt under same entry number 74. Next point. There is already dot there. Renting of premises by the hospital, that is chargeable to tax at the rate of 18%. Suppose there is a hospital, it's given a premises on rent for medical shop, for diagnostics labs, for cafeteria, for ATM. The rent collected is chargeable to tax at the rate of 18%. There is no exemption. One more point here, like as we are discussing medical shops. Suppose there is a hospital. In that hospital, there is a medical store. What is happening that the hospital is selling that medical medicines to anyone, not just the patients who are admitted in the hospital. It is not exempt because that is a sale of goods. What is exemption entry number 74 is a healthcare services. selling of medicine as a sale of goods is not exempt. It's chargeable to tax. So in many hospitals you will find that there is a demarcal place available for the medical store. Separate GST registration is there, not having any relation with hospital. Because of this point, let's twist this little bit, twist, because CS students, we need to twist this. Suppose in a hospital, uh, there is a patient who is admitted and hospital gives some medicines to that patient. That is exempt because of the concept of composite supply. Section 8 of CGST Act. The main service is a healthcare service. Supply of medicine is a composite supply. That is exempt. This is not exempt. Okay. Let's go to the next point. There is one more point in case of a hospital which is not covered here, that suppose a food is supplied by the hospital. Let's take an example that there is a hospital, person is admitted, there is a patient, and because of a particular treatment, hospital gives food to that person, food to that patient. Whether it is chargeable to tax or exempt, it is exempt because of the same composite supply, section 8 of the CGST Act. The main service is a healthcare service. Along with that, the food is supplied. However, if the food is supplied to attendance of that patient, that is not exempt, that is chargeable to tax. Suppose the third person supplies to the hospital, that are chargeable to GST. That is not exempt. The input services to the hospital is not exempt. That is cost to the hospital. Therefore, it is said that in GST, the exemptions are not good. Why? Because hospital may purchase the crores of rupees machinery and paid the GST, but not eligible for input tax credit, as the output service of the hospital is exempt. The input tax credit is not available. Therefore, exemptions are not good in GST. Have you understood? Suppose a hospital is having a canteen. The third person is not supplying food to the hospital, but they are having a canteen. Then the input and capital goods used in that canteen, the ITC credit is not available. Let's see these miscellaneous points. Suppose there is the waste collected by the agency from the hospital, that is not exempt, that is chargeable to tax. Why it is not exempt? Because this is provided by the third person to the hospital. No service is provided to the patient, not a medical service. So you need to understand that a GST is a transaction level tax. You should not see what is the ultimate this service is to the patient. No, each transaction you need to see, you need to evaluate separately whether it is exempt or chargeable to tax. If chargeable to tax, at what rate, then payment of tax, filing of return, etc. Okay. Now this is a card bank service. They basically, what is this service? They are storing that sales. That is not exempt. That is chargeable to tax. Why it is chargeable to tax? Because it is not a healthcare service. It is preventive. There is no treatment. There is no illness at the time when that sales are stores. Okay. These services are biological storage. Therefore, this is not exempt. This is chargeable to tax. These are my contact details. If you are having any questions relating to GST, please contact me. I will answer. Thank you.